Meanwhile, in Colorado Springs, medical officials are speaking up.
They say despite what's happening in Texas, there is no need to panic. Fox 41's Tori Kay has more.
Joe, Lauren, when patient 0 came into the hospital, they didn't focus on where he traveled and instead sent him home, all of which is against CDC guidelines. The medical community says that this serves as a reminder, and now they are more prepared than ever. Ebola is a disease that has not only caught national attention, but also attention here in Colorado Springs. And even though there has been some medical mistakes, residents say as of now, they aren't worried.
I think it's a bit of something to think about, but I don't think it's anything to panic.
Until something happens, then you can start being concerned.
Penrose-St. Francis Hospital agrees.
So if someone shows up in the emergency department with symptoms that tie in with Ebola, they're trained now to ask that question. Have you traveled to Africa recently? And ask those questions. Have you been to certain countries recently? Just to bring that to the top of the conversation instead of waiting for it to come up later on in conversations.
The other good news is getting a disease like Ebola is far more difficult than getting the common cold.
I would tell my patients that unless they came into contact with infected body fluids from the infected patient, a sick patient, that they have nothing to worry about.
Another thing to note, viruses like this are not uncommon. In fact, Ebola is being treated very similar to H1N1, a virus from a few years back.
All the hospitals were prepared for it. We addressed it. We handled it. We got through it now. So now this is the next thing that we're aware of and getting ready for if it spreads.
Focus on the Family suggests parents discuss this with their children. It's best to keep them aware of what's going on and also keep them calm. If anyone has questions on how to approach this, they say they have counselors who would be happy to help. Lauren.